the importance of the necessary conversation in healthcare.
Yeah, especially how nurses are being trained to talk about death and existential issues with patients.
Exactly. At Holbeck Hospital, they're teaching nurses how to handle these conversations.
That's fascinating. How are they doing it?
Well, they're using simulation training with actors, so
Right.
nurses can practice in a realistic but safe setting.
That must be really valuable, but isn't it difficult for nurses to discuss such heavy topics?
It can be challenging, but nurses like Annika Sorensen find that patients often need someone to talk to.
Yeah.
They appreciate the human connection.
I suppose doctors might focus more on the medical facts.
Exactly. Nurses bring in the humanistic aspect, focusing on care and presence. They balance the clinical with the emotional.
But shouldn't doctors also engage on a personal level?
Well, some doctors might have, Berührungsangst, a kind of reluctance towards discussing spiritual matters.
I see. But isn't it important for all healthcare professionals to address patients' existential concerns?
Definitely. That's why the hospital chaplain Thomas Good Bergson is involved.
Interesting.
He helps train them to navigate these conversations.
So they're learning to ask questions about patients' fears and beliefs?
Yes, like gently probing into their thoughts on death and the afterlife.
Right.
It can be very comforting for patients.
But isn't there a risk of overstepping boundaries?
There is, but with proper training, they learn to handle it sensitively.
Yeah.
It's about being present and listening.
I can see that, but I wonder if some patients might not want to discuss these topics.
That's a fair point. It's important to read the patient's cues and respect their wishes.
Absolutely. So they're calling it the necessary conversation instead of the difficult conversation?
Exactly. To encourage healthcare professionals not to avoid it. The term makes it feel more approachable.
Words do have power. It changes the mindset.
Yes. And good communication can prevent misunderstandings and complaints.
Right.
It improves patient care.
It's amazing how much impact a single conversation can have.
It really is. As Thomas said, the content of these conversations can affect patients for the rest of their lives.
That's profound. So how do the nurses feel after the training?
They feel more confident and prepared. They can
That's
support
great.
patients better during tough times.
Do you think this training should be standard in all hospitals?
I believe so. It's like giving healthcare workers the tools to make real connections.
I couldn't agree more. It's essential for quality care.
Indeed. Ensuring patients feel heard and understood is crucial,
Yeah.
especially when facing life's big questions.
Well, thanks for bringing this topic to light. It's been enlightening.
My pleasure. Always happy to discuss important issues like this.